someone is diagnosed with a blood cancer. Every 10 minutes, someone loses their battle. Leukemia is one of the leading causes of cancer death in children and young adults under the age of 20. The Leukemia and Lymphoma Society exists to find cures and ensure access to the best available treatment and support for all blood cancer patients. We accomplish this by programs such as our Blood Cancer Conference, monthly support groups, regular health educator programs, patient assistance programs, both in the form of transportation assistance and copay assistance, and our annual children's holiday party. The Leukemia and Lymphoma Society recently updated its 3-year strategic plan. At the heart of the plan is to connect patients with core services soon after diagnosis to address their informational, practical, and supportive needs during their cancer journey. The ultimate goal is to reach patients within the first 90 days of their diagnosis. In San Diego, LLS programs and services reach approximately 500 patients annually, but we're not reaching all of our patients early enough in their diagnosis to make an impact on the important decisions they are faced with, nor are we maximizing our impact in diverse communities in a culturally sensitive way. There is a considerable blood cancer burden in our diverse and underserved populations. The blood cancer incidence rate in Hispanic children in California is 16% higher than the same population across the country, and the survival rates are much lower in Hispanics than in non-Hispanics.
One of my roles at the Leukemia and Lymphoma Society is to connect patients, families, and caregivers to LLS as soon as possible after their diagnosis, so they can be made aware of the services available to them that are not being provided by their physician or the hospital where they're receiving treatment. There is a critical need for volunteers who represent underserved populations in San Diego. Volunteers who not only speak their language, but who also understand key cultural issues and can sensitively provide support. As a volunteer myself, I have seen firsthand the impact of peer support to patients and their families in making important medical decisions.
LLS is dedicated to reaching more patients. A grant from the Alliance Healthcare Foundation would help us to improve our infrastructure and achieve a 20% increase in the number of newly diagnosed patients that receive programs and services from the Leukemia and Lymphoma Society. Thank you for considering a grant to our organization.